Well, MCG, we work with them to do clinical validation on our programs. So especially on our hospital discharge programs, we've been working with them to confirm our guidance that we give for people who've been hospitalized for acute myocardial infarction, heart failure, those types of conditions. We offer engagement programs with members, with patients who've been discharged from hospitals, as well as for other reasons. And our programs are all text messaging based. So our role is to really engage people over a long period of time, sending them anywhere from a couple of messages a week to maybe a few messages a day, depending on the health objectives and that they're trying to achieve and the intensity required to make the behavior change happen. So our programs are all designed to work with people to establish those healthy habits, whether it's around diet or exercise or taking their medications properly or whatever that may be. MCG, with the strong clinical foundation that they have and the evidence-based guidelines that they work from, it's a perfect fit for us because we're able to take our behavior change programs and ensure that they follow the best practice evidence-based guidelines. We know anything we get from MCG is going to be very well researched and the best clinical tracks that we can possibly be following. Sharp has just been a real success story for us. They have used a wide range of our programs, and specifically the hospital discharge program, they've seen some outstanding outcomes. Sharp already had a really strong readmission rate for 30-day and 90-day readmission rates, but they wanted to do even better, so they deployed our programs, and we found that we were able to help them improve their 30-day readmission rates by over 22% improvement, and on the 90-day we were over by 46%. We improved their readmission rates. So they've had really good success with our programs, and with the MCG clinical guidelines, it allows us to be far more specific based off of hospitalization reasons to make sure we're giving people the best advice possible for their recovery. The hospital discharge program is really getting a lot of attention, and especially the outcomes that we've seen at Sharp. So we've been able to apply those solutions with other hospital systems, provider groups, and health plans, and it's worked out really well. We're continuing to build out more and more program suites. There's just so many opportunities to engage patients on their health that there's a lot of programs we want to continue to roll out. There's also, our system is getting far more sophisticated and smart so that we're able to deal with a lot more comorbidities and deal with a lot more individual scenarios so that we can be sure that we know, the more we know about the patient, the more we can apply clinical rules to give more specific direction on how to help them. So we'll be doing a lot of work on that front, continuing to make our programs more sophisticated to deal with a lot more chronic and complex conditions as we move forward. MCG has just a phenomenal background on their evidence-based guidelines. We know that not only do they use evidence-based guidelines, but they work through all of the guidelines to make sure that they know which ones are the best ones that have the best evidence that we can really hang our hat on. So we'll work with MCG on every front we can, especially the more clinical it gets, the more important that relationship becomes for us.